Dr. Reinfeld, yesterday we got a question on social media asking if somebody has a thicker, kind of fattier nose, if you could make it thinner.
Yeah. Okay, so that's an interesting question because we obviously don't know exactly what they mean by fatty nose. But let's think about this. They may be talking about just a broad nose. And so what makes a broad nose broad, wide? It could be that it's just the bones and the cartilage are wider, separated, fuller. Or it could be that they're talking about a nose that has thick skin and therefore looks broader, wider, especially on the tip, right? So different issues. Let's take the latter issue. If someone has a thicker skin, it definitely is true that you can have some challenges in creating shape, making it look thinner, making it look refined. And often people sort of make the mistake of thinking that to make a nose like that look smaller, you have to remove cartilage. The thing is that doesn't really help. What you really need to do is build structure underneath to almost push out, stretch out, shape the overlying skin. So in many ways that can mean adding cartilage, okay, in the form of grafts. Maybe adding grafts that you have to take from elsewhere in someone who has really thick skin, grafts perhaps from the rib or from the ear. Now let's take the other example. We're taking an example of normal or even thin skin of a nose that looks broader because the cartilage is big, thick, and wide, and the bone is wide. Well, the way we handle bone is by doing what we call two things: osteoplasty, which means removing a little bit of bone, essentially sculpting it, either with rasp or with a piezotomy. The electric bone cutter also has a scraper device where you can scrape away some bone. Or what we've been doing a lot recently is using a burr, so like a spinning Dremel tool, to burr away some bone. So that's one way, osteoplasty. Second way is breaking the bones, and those are osteotomies, meaning breaking or fracturing in controlled fashion, usually using a piezotomy, at least in my practice. So that's how we would deal with the part of the bridge, the upper part of the nose, the upper half, upper third of the nose that's bone. But when we're thinking about cartilage, how do we handle the cartilage, especially the tip cartilages? So again, remember the example is normal or thin skin, and cartilage underneath that's broader, wider, thicker. The way we handle that is the total opposite of how we handle the cartilage for someone who has got thick skin. In those particular situations, we're reducing the amount of cartilage, sometimes making incisions and removing a little bit of cartilage, or making incisions in the cartilage and overlapping it so what is seen from the outside is thinner, but we still maintain the structure. So the answer to the question, as you can tell now that we're going on many minutes, is a really complex one, because what makes a nose broader is very different in two different population types: thin skin, thick skin, big cartilage, small cartilage. I hope that helps.